In 2005, Pamela and Kevin Durkin welcomed their newborn son, Colin. Shortly after they brought him home, they realized he was sick and took him to a nearby ER. They found out he had been exposed to pertussis, a deadly disease, especially in newborns. Vaccines are a medical marvel that save lives. They are a safe, well-researched, and heavily regulated way to protect adults and children. Today I'm going to talk about what vaccines are, how they are made and regulated, why we vaccinate, and what could happen if we fail to vaccinate. I myself am a certified medical assistant. I work in a family medicine office, and I have for about 4 years. We give anywhere from 5 to 15 vaccines every day, so we have to have a continual working knowledge of vaccines and how to safely administer them. Along with my working knowledge, I have extensively studied the CDC website in preparation for this speech. So what are vaccines? Vaccines are a small amount of a particular virus that's injected into the body. Once it's in the body, it stimulates the immune system to start creating antibodies. And once antibodies are made, you have gained immunity to that particular virus. This is what makes vaccines so powerful. Unlike most medicines that treat or cure an illness once you have it, vaccines actually prevent them from ever happening. You don't have to have the disease to get the immunity. One of the biggest arguments I hear every year, especially during flu season, is that somebody's flu shot gave them the flu, which is impossible. Vaccines prevent illness, they don't cause them. There isn't enough of the disease in the injection to cause illness or death, and even if there were, the virus is actually deadened. Because what's happening is your immune system is busy and it's trying to make antibodies for the virus that we injected, and so another pathogen or disease can come in and cause illness. Now that you know what vaccines are and why we use them, we can move on to the safety and regulation of them. Safety starts with making the vaccine. One of the biggest arguments right now with people who don't want to vaccinate is that they don't know what's in the shots, and vaccines are full of toxins and they're unnatural to the body. Vaccines are made with safe ingredients that are easily handled by the body. These ingredients include adjuvants, stabilizers, and preservatives, all of which are naturally occurring in your body. Each vaccine is very small and has a small amount of each component in it. Each vaccine is about 0.5 milliliters, which equates to 2.5 teaspoons. So in comparison to the human body, it's a very small amount. All ingredients in vaccines play necessary roles. There's a reason why they're in there. And you can find ingredients listed on the package insert, and I'm going to show that to you now. These are found in vaccines when we get them at the clinic. It goes over ingredients, dosing, safety and storage, and possible adverse reactions and how to handle them. So regulating vaccines is the next step in safety. They are vaccines. Before they go to market, they have to pass a rigorous course of tests and measures before being introduced into that community. Once it passes the tests and measures, it's considered licensed, and it continually gets regulated throughout the course of its life by the FDA, the CDC, and the NIH. Administration is probably the most important part of vaccine safety. It starts the minute the patient comes into the clinic. We screen the patient, make sure that they aren't ill, that they're not fighting something already, they don't have allergies to some component of that vaccine, and then we always check with the vaccine schedule, which I have up behind me here. The vaccine schedule was made by a group of experts in the field, including the FDA, the CDC, medical professionals, and scientists. They've broken it down into the first year of life here, which is your 2 months, 4 months, 6 months, and 1 year. This is where you find the majority of your vaccines. And then you get over here to your 18 months all the way into your adulthood, which you can see gets much more sporadic. So once we look at the schedule, then we draw the vaccine up. We do that using this needle and syringe. The first needle is what you actually draw it up with. Then you switch the needle out and you put a fresh new one on there. This being because we want the first thing that this needle touches to be the patient's skin, and that way we can ensure that it was sterile. Once we give the vaccine, we give parents or patients this piece of paper. It's called a VIS, or a vaccine information sheet. It goes over why you should get the vaccine, who shouldn't, risks, side effects, and where you can find more information. Once we give the vaccine, we have the patient sit and we monitor them for 15 minutes. We do this to make sure that they don't have an adverse reaction. However, serious adverse reactions are very rare. In February of this year, vaccines.gov stated, serious side effects from vaccines are extremely rare. For example, if 1 million doses of the vaccine are given, 1 to 2 people may have a severe allergic reaction. Now that you know how safe and well-regulated vaccines are, let's talk about the dangers of not vaccinating. What could happen if we fail to vaccinate? So we have what's called high-risk groups. These are groups that are immunocompromised, they're too young to receive the vaccine, or they have allergic reactions to vaccines. They depend on the mass majority of the community to get vaccinated to help protect them. This is what's called herd immunity, or also called community immunity, which basically means the mass majority, or over 80% of the community, need to be vaccinated so that a communicable disease can't spread through them. If herd immunity fails, we can slip into a pandemic, which is a virus that is affecting multiple regions, possibly global, which of course can lead to the most unfortunate side effect of not vaccinating, which is death, which actually happens more than you think. According to Healthline, the average number of yearly deaths internationally from the flu was 290,000 to 650,000. The low end of that being the population of Boise, and the high end of that being the population of the entire Treasure Valley in 1 year. Today I have provided ample information for why we should vaccinate ourselves and our children. I have done this by showing the safety and regulation of vaccines, what they are and why we use them, and what could happen if we stop vaccinating. Vaccines are a medical marvel that save lives. I showed you that vaccines are a safe, well-researched, and heavily regulated way to protect children and adults against preventable diseases. Colin Durkin's illness rapidly worsened that night at the ER. After 7 weeks and numerous tests and treatments, Colin died. He was too young to be vaccinated, and the adults in his life did not vaccinate themselves to help protect him. Colin's family was devastated. His mother stated, "We never had the chance to immunize Colin, as he was still too young. But an ounce of prevention could go a long way in saving a child's life." Today, I would like each and every one of you to think about vaccines and realize that they are not only safe, but vital to our health. When you get home today, educate yourself further so that you can do the right thing and get vaccinated. Like Jeffrey Klugger says, vaccines save lives. Fear endangers them.